Hey guys, so last section of chapter 25 are going to be the parasitic infections, or our protozoans, that are going to affect the circulatory and lymphatic. So first we are going to start off with the biggest, baddest one out there, and that is malaria, which kills millions of people every year um, that get exposed to it. What is our causative agent? It is plasmodium, and there's different that's oh my gosh, sorry. That's the genus, Plasmodium genus, and there's a couple of different species that can cause malaria. Malariae and oval and Nowelski, falciparum are all different ones that can cause malaria. There's also Vivax that does it too. So how do you get malaria? We just talked about this with yellow fever. Mosquitoes are our big vector for malaria. So we have the whole life cycle here that the mosquito is going to bite the person to get that blood meal. And then it is also going to pass on this plasmodium. And so it passes it on, it gets into the blood, which then goes to the liver because the liver is going to filter your blood. So it goes in the liver and it hangs out in those cells. Those cells get infected, it multiplies, and then it ruptures out of the cells as merozoites. And so these go into the bloodstream, these ruptured liver cells pop out all of these merozoites that were growing in there. They go into the bloodstream and then they take over the red blood cells. So in this, we're going to have these red blood cell stages where every couple days, depending on which species you're talking about, every 2 days, every 3 days, sometimes it's a little more, sometimes it varies. It depends on the species. They are going in and growing inside these red blood cells, and then poof, they all pop at the same time. So when that happens, it's really miserable and violent, and it is going to lead to fever and chills and pain and headaches and nausea and vomiting. Um, and then it can, as everything ruptures at the same time and it kills off all these red blood cells at the same time, it makes the blood all sludgy. I think is what they refer to it as, sludge blood. Um, because all of these ruptured red blood cells are in there. So that's going to clog up the blood. It's going to clog up your spleen, your liver. It can cause the blood vessels to clog up because your capillary beds are only as big as like one red blood cell, right? And if they're all clogged up with this sludgy blood, then it can cause those guys to not receive oxygen and to die and have necrosis. Um, it can clog up your kidneys. It can lead to organ failure and death. So malaria, again, kills millions of people every year. With this, we cover the blood cycle. So during the blood cycle, it is going to produce with meiosis a gamete. Excuse me. The next time a mosquito feeds on the same person, it's going to take in those gametes. And then we have the mosquito stages where we have the adult or zygote. It's going to undergo mitosis, and then it's going to produce the sporozoites, and those are then passed on to the next person. So this video kind of covers the malaria life cycle too. It's a really good one. I like to have everybody watch that one to talk about malaria. There are drug treatments if you are infected with malaria. There are definitely treatments out there that we've been trying to treat malaria since, like the 1800s. Since we have been treating malaria for so long, a few of these guys are drug resistant. So we have to come up with different ways to treat them. The best way is prevention, is to stop this from happening. So to try and, use mist nests over your bed. We sleep with those at night. Try to limit your contact with mosquitoes and try and possibly kill off mosquitoes. And if you're in an area that is prone to this, so prevention is the best key to try and stop this from happening. There are drugs to treat this, but it is not fun. for anybody. Here is a picture of that plasmodium inside the red blood cells. So we have our schizont. Here's our little ring form in there that it's talking about when it's talking about our ring stage here. Here we can see it in this blood cell right here. Oh, excuse me. So Plasmodium is the genus and the different species, and there are a few, cause malaria, spread by mosquitoes. Let's move on to another disease. This one can also infect people. It is Toxoplasmosis gondii, and toxo can be spread in a number of different ways. If you look at this map, it looks like there's all sorts of different things. It can use chickens and rodents can be intermediate hosts because they pick this stuff up from the soil that is covered in the oocytes or the eggs that have been shed off by an infected animal. So chickens can pick them up, rodents can pick them up, other livestock can pick them up. And if you eat the livestock that wasn't, cooked properly, then you can then infect yourself by eating the livestock. Another common way that you can infect yourself is that cats are hosts. Your domestic cat may be a host and it ate the rodent, that picked up toxo, and now the cat has toxo. And you don't really know the cat has toxo because he's fine, but he's pooping out these, or she is pooping out these eggs, these oocytes, and you are cleaning the litter box. And forgot to wash your hands when you clean the litter box, which is super gross, and we all know better. But that's another way that somebody can get infected because their cat, they were cleaning the litter box from their cat. So typically for people that have, a really good immune system, things are fine. Issues happen when somebody is immunosuppressed. If somebody picks up toxo and they're immunosuppressed, it can cause other issues. It can cause and lead to serious things like encephalitis, pneumonitis, seizures. If mom is pregnant and she gets toxo, she was cleaning the litter box when she was pregnant, this can pass on to baby. And that can lead to potentially death of the baby. So we, need to make sure that everything's okay. So T for toxo is the T in the torch test that gets performed to make sure everything's okay. So this is Toxoplasma gondii, and it can be spread by oocytes that you're picking up. It can be spread by infected animals that you may have eaten that weren't cooked properly. I always hear about it with cats and litter boxes because cats are the reservoir for these things to reproduce in them. Here's what toxo looks like under the slide and what a cyst with these little boogers inside looks like. Next disease, babesiosis. This one is not transmitted by pets. This one's going to be transmitted by ticks. So that can give you babesia, and it's going to infect the red blood cells. So similar infection kind of style to malaria, where these things get in the red blood cell, and after a couple days, they're going to rupture and burst and invade other red blood cells. Babesia is kind of similar to toxo, that if you have a healthy immune system, that normally you should be okay. You might even be asymptomatic. It can progress though. It may progress from, a fever and headache and pain to swollen spleen, and, malaria-like symptoms. And when the red blood cells are rupturing, you may have hemoglobinuria, where you're seeing hemoglobin and blood in the urine, where normally you are not supposed to see those things in the urine. It can lead to kidney failure, and potentially be fatal in those that are immunocompromised, people that may be had their spleen removed. If you had a babesia infection that you had fought off, but then you had your spleen removed later, it said that it may come back and progress and come out of dormancy, basically, and progress if that should happen. Again, most people don't need treatment. Many people are asymptomatic for having this, but there are drugs that can be used to treat this if needed, which is nice. Chagas disease, or the kissing bug, is how this thing is spread. So this is Trypanosoma. Here is the kissing bug. Why is it called the kissing bug? Because these little boogers live in tropical environments, warm environments. They're starting to spread up through Texas, by the way. Global warming is not our friend. T. cruzii lives in the kissing bug, and it is called the kissing bug because it likes to get a blood meal. It feeds on you. And so oftentimes this happens at night, and so it'll crawl up on your face. Crawls up on your face, takes a blood meal, and then poops when it eats. And then you're like, oh, in the night, and you rub that feces into the wound, and that's how you can get Chagas disease. So symptoms for these start off acute. So fever, headache, pain, rash, vomiting, diarrhea. You may get a nodule wherever the thing bit you. It's usually around the eyes or around the mouth. It could swell up, and that is called Romania's sign. Near the bite wound, you might have swelling, a nodule, and that's kind of the giveaway of what this could be treated, because fever, headache, rash, could be lots of different things, but that's kind of the giveaway. You can definitely confirm this with PCR, like almost all of these other things that we're talking about. PCR is the way to go. There are other EIAs too that you can use. So once this happens, most people resolve this. Most people are able to fight this off at this point, at this acute stage, and it goes away and they're okay. There's a percentage of people that don't, though, and they will progress from that acute phase to a prolonged phase. Like 30% of those go into this chronic phase. And so after it becomes chronic, it can lead to symptoms like a swollen esophagus. It can lead to swollen colons. So a swollen esophagus makes you not want to eat. You can't swallow your food. A swollen colon makes it hard to go to the bathroom. It can also lead to an enlarged heart, which is absolutely serious and can cause heart failure and death. So a small portion of these, 20 to 30% of those that are undergoing the acute infection, will progress to chronic and could possibly have these life-threatening symptoms that show up later on. There are drugs to treat Chagas disease, and they're best taken in that acute phase when it's first kicking in with the fever and the pain and all of that. The later you take it, if this is a chronic situation, the less effective the drugs are. The best way is to control the bugs that are spreading the disease. Leishmaniasis is another protozoa, so we can see him. And it has 3 different ways that this thing will show up on the body. It's spread by a fly. So this sandfly bites you, and it spreads this protozoan, and it shows up in 3 different ways. This one is the cutaneous, on the skin, and it's usually one that you can, fight off after a while. Sometimes it takes a little while to fight it off, and you might have scarring left over. But usually you can get over the ulcers and the blisters from this cutaneous. But there's also 2 other ways that this may manifest, and it's visceral or mucosal. And so visceral is going to attack swollen lymph nodes, liver, enlarged spleen, all of that. It can also attack the bone marrow on the visceral version. And we know that bone marrow is where your red blood cell, your white blood cells, your platelets, all of your hematopoiesis is happening in your bone marrow. So if this goes into visceral and attacks your bone marrow, that's definitely something serious when you don't have enough red blood cells or you don't have enough white blood cells to fight something off. um, that's definitely serious and could lead to, a fatal infection. Mucosal is going to attack, just like it sounds, mucosal membranes, and so that would be in places where you're going to see mucosal membranes, like mouth, respiratory passages, that kind of stuff. And so this one is the most rare. The cutaneous is usually the most popular. Diagnosis, PCR, of course, like everything else. And if you had the more serious ones, the visceral or the mucosal, there are drugs that can treat it. Typically, that cutaneous will go away. And our last one, schistosomiasis. Schistosomiasis is a fluke, and there's an intermediate host. You pick this up in the water. There's an intermediate host in the water, which are snails, and so like every body of water is going to have snails. We usually find this guy though in warm water, so Caribbean, South America, um, Africa, Asia, warmer areas in those continents. Um, have schistosomiasis. So you're in the water, the snails are in the water, they're an intermediate host. The adults come out of the snails, and then they are going to be able to get into your skin. So usually when we talk about flatworms, trematodes, you have to ingest these things. You have to eat them, or bring them in somehow, um, through your mouth. You ate undercooked food, or you got the feces and you didn't wash your hands, but with these, they actually burrow through your skin. So that's how you pick these up, schistosomiasis. Once you get it in your body, it's going to show up as a rash, and then they start to grow and mature and produce gametes. They start producing eggs, and those are going to be sent out through feces and urine, and that's how we're going to pass it. And then if you're infected and this makes it to the water body, then the cycle just continues on. So easy diagnosis is to look at somebody's feces and urine and see if you can find the eggs in there. Treatment for this guy is similar treatment for all of our trematode infections. Praziquantel is a really good flatworm treatment. Best prevention is clean water. Improving, waste so it does not get into the water system would be the best. Criteria can manifest in places that it shouldn't be, um, for this. But there are drugs, again, if you can catch this in time for schistosomiasis, you should be able to treat it. Chronic infections can lead to retardation in children and other negative effects. So this is one that we know how to treat it. It's just, does the person know that they need that they have it, and are they able to get to medical help? Are they in a place where doctors are few and far between and medicine is not easy to come by? So that is our last one, schistosomiasis. That is our last one out of this chapter. Let's check in with our patient. So Barbara came in for chemo for her breast cancer, and they put in the pump, and her pump got infected, and she continues to decline. She went into shock. Her blood pressure dropped. They were trying to treat her with the drugs to combat the sepsis, but she went into liver and renal failure, liver and kidney failure, and she passed. So Barbara, who was fighting breast cancer, ends up dying from a staph infection, from MRSA. And we know MRSA can be hard to treat, and she picked up this MRSA as a biofilm on her pump. So this is not how I wanted to end the chapter on this. But definitely cancer affects so many of us. All of us, I know, have been touched with cancer in some way, shape, or form. And I know my My brother-in-law, when he had cancer, he had a pump and it got infected too. So at first signs, if you know somebody that's got a pump and it starts to get infected, please have them treat it right away. Usually they will yank that pump out and treat that area and have to do another one later. But please, y'all know now about Barbara and her story about MRSA, and you know what to do and what to look for. So if you have any questions about chapter 25 and our circulatory and lymphatic diseases, please shoot me an email. Have a good one.